Good afternoon. I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. I am here today with my fellow commissioners, Vice Chair Ken Lawrence and Commissioner Joe Gale, Dr. Alvin Wong, Regional EMS Director, Dr. Brenda Weiss, Administrator for our Office of Public Health, and I also want to thank Sarah, who's been with us here for the last several days. We really appreciate her being here. Coronavirus in Montgomery County continues to be a very rapidly evolving situation. I will do my best to give you complete information today, but just want to warn you that I may not be able to fully answer all of your questions. As has become our practice, I'm going to update you on what we have learned since our conference yesterday. So since March 12th, we have 4 new presumptive cases of COVID-19 in Montgomery County, which brings our total to 17. The first is an adult male, 37 years old, who resides in Skippack Township, whose symptoms do not require hospitalization and is currently at home being monitored. This individual had direct contact with a previously identified presumptive positive individual in Montgomery County, and contact tracing is underway. The second is an adult female, 36 years old, who resides in Skippack Township in the same household as the individual noted previously. Her symptoms do not require hospitalization, and she is currently at home being monitored. Contact tracing is suggesting that this individual contracted coronavirus from the individual noted above with whom she resides. Additional contact tracing is underway. The third is an adult male, 45 years old, who resides in Collegeville Borough. His symptoms do not require hospitalization, and he is currently at home being monitored. This individual had direct contact with a previously identified presumptive positive individual in Montgomery County, and contact tracing is underway. The fourth is an adult female, 41 years old, who resides in Collegeville Borough in the same household as the individual just previously noted. Her symptoms do not require hospitalization, and she is currently at home being monitored. This individual had direct contact with a previously identified presumptive positive individual in Montgomery County. Contact tracing is underway. So we've been talking this week a lot about contact tracing, and we wanted to give you a visual representation for a single presumptive positive individual here in the county, because we want to help people understand the impact that one person can have on our community in just over 5 days. This is why we have taken the mitigation measures that we have, and this is why it is so critically important to follow quarantine or isolation orders. So just to walk you through this, that middle red dot right here, that was what we would call the index patient or the first patient. Everyone who is a direct red dot from that middle red dot was green at the beginning of this, but has now become also a presumptive positive. And the green dots represent these direct contacts from the presumptive positives. And you can see how this will grow. I can assure you that it is quite likely that some of the green dots on this chart will turn red in the days to come. So again, this is one individual over 5 days and the impact on our community here just in Montgomery County. These are just Montgomery County contacts. I would like to update you on some of the steps that we are taking in our community to make sure that our residents are safe. First, I want to thank some of our partners who provide utilities to the residents of Montgomery County. Effective today, PECO is suspending service disconnections and waiving new late payment charges through at least May 1st, 2020. Customers who may be finding it difficult to pay their energy bill or have a disconnect notice should contact PECO Customer Care as soon as possible. Their number is 800-494-4000. PECO will work closely with customers to waive late payment fees, avoid having their service shut off, and determine eligibility for assistance programs. Additionally, just before we came in here, we received notification from Aqua that they are putting a moratorium on all water terminations. I don't have any more details or dates around that. Literally just got a quick text message from them that I could announce that at this press conference. Right. Next, I'm going to move to some of our efforts around human services. I want to remind all Montgomery County residents about our Navigate program. That is our one-stop shop for all human services needs. Anyone in this county who has any unmet human service need at this time should call this number, 610-278-3522. So if you are having an unmet need around food, around home care, child care here in Montgomery County as a result of coronavirus, you can call 610-278-3522 and they will work to help you. So just a couple brief updates. I want to emphasize that we are making every attempt to keep our food pantries open. They are critical infrastructure here in our county. If you go to a food pantry, please follow all posted directions. They're going to have you stand in line 6 feet apart. They're only going to let so many people come in at a time. And most of our choice pantries are moving to that more traditional approach where they give you a bag or box of pre-boxed food. But again, that's just for this time of this emergency. Our Monco Anti-Hunger Network has been a wonderful partner in this work. They provide resources to 39 food pantries and help feed more than 15,000 households every year here in Montco. They are continuing to work. I want to mention another one of our service providers, RSVP. They are looking for volunteers to help treat their client or serve their clients during this time. If you can volunteer with RSVP, please email Kathy S, KATHYS, at rsvpmc.org for more information, and they can tell you what it is that they need. Our home care providers are prioritizing home health and personal care for individuals who have no caregiver at all in their home. Again, if this is an issue for you personally, please contact our Navigates. For our seniors, all senior centers are now closed in Montgomery County for the routine socialization type activities. However, if you eat at one of our senior centers, you can stop by to pick up a takeout meal. It would be wise to call ahead and make sure you're clear on the hours that those meals are available. But they are providing takeout meals, and Meals on Wheels is still operating. Meals on Wheels is still operating. In terms of child care options, particularly if you qualify for subsidized child care, there are several options for you. I would again ask you to call our Navigates at 610-278-3522 to get information or to share information with them in your personal situation, and they will be able to guide you on the complexities of that. I do want to announce that PA Career Link is closed, and that the libraries that are in our Montgomery County Library Network will be closed as of 6 p.m. today until at least March 30th. Some of the other individual private libraries, you'll have to check with them. But these are the libraries that are in our county network. Our parks, all of our park staff will continue to execute project maintenance and management work. All rentals, permits, and events in our parks are canceled. No historic site tours or programs will take place. I want to emphasize, and I've gotten a lot of questions about this on social media and haven't had a chance to answer them. Our trails are open, and you can absolutely get out on our trail system get some fresh air, enjoy this sunshine. It is a wonderful way to decompress with the stress of these times. So please, feel free to get out and utilize our trails. Now, some words for our business community. Our Dave Zellers, who leads our Commerce Department, has been working with our business community. Our businesses are recommended to post signs on their doors for whatever practices are currently in place within that business. For restaurants, we're asking them to consider takeout models only if they're able to do that in their restaurant, at least for this short term, or if they're able, if the restaurant's big enough, provide at least 6 feet between tables. We are recommending that they have hand sanitizer or gloves at entrances. That also applies to gas pumps and places like that where you have to use your hands to get the product. And we've got a number of other recommendations for our business community. We are working on new additional FAQs and drop-down menus on our hub website to put all of this information together in one place. So let me give you that hub website again. It is www.montcopa.org/COVID-19. I'm sorry, COVID-19. montcopa.org/COVID-19. Our public information line, if you have a question that cannot be answered on the website, is 610-631-3000. That will be open until you hear differently from me, from 7 a.m. to 8 p.m. 7 days a week. We've now established an email. So if you have a specific question that you can't get answered on the hub and you aren't able to get through on our line or just want to email it for convenience, you can email COVID-19, COVID-19 at montcopa.org. COVID-19 at montcopa.org. And before I take your questions, I want to announce that tomorrow, Saturday, March 14th, our press conference will be here at 2 p.m. And with that, I will take your questions.
What is the restriction on Montgomery County residents? Can they go into Chester County? Can they go to Bucks County? Do they have to be at home? I'm sure that you've heard by now that there were some harsh words coming out of Philadelphia in regards to what their school system then faced due to the employees mainly living here. So what are the rules?
Let me just, since you mentioned Philadelphia, I do just want to take a moment and express the condolences on behalf of our entire Montgomery County family, all of our Montgomery County first responders, certainly all of the elected officials here, to Philadelphia and to the family of Corporal James O'Connor for that very tragic loss of life that was experienced in Philadelphia today. We're very sorry about that. So in terms of any restrictions, we continue to await clarification from Governor Wolf's office. We have received nothing in writing beyond the remarks that he gave publicly yesterday. I would want to clarify one thing that were in those remarks that seems to have been misinterpreted. In his remarks, he stated that Commonwealth employees of the state, were not to commute from Montgomery County to Harrisburg or to other state offices. That was the extent to which he described workers. I think that statement was overinterpreted by the public.
But when you close all the schools and all of the daycares, parents now need to stay home. So what did we think was going to happen with that in terms of other workers going to work other places, like in other school districts?
So my role these last 6 days has been to make sure that our response here in Montgomery County, which has been the epicenter of this crisis in this state, was as robust and safe as possible. We've been working with our school districts from the beginning, we were working with them before we even had a presumptive positive case, to prepare for the possibility that we might have coronavirus in a widespread way in our county. We have been in regular communication with them. We have been working to understand the very real needs of children who go to those schools. You've heard me say just about every day in these press conferences how difficult the decision is to close schools because so many of our children get their most nutritious meals of the day at their schools. And obviously that the parents build their work schedules around those schools. So several days ago when people were asking me why the schools weren't closing, that was some of the reasons we articulated as to why this was such a difficult decision. I shared this graphic with you today so that the public could begin to understand the impact of just one person with a presumptive positive coronavirus test over just 5 days in our community. These are some of the reasons why we decided to close the schools in Montgomery County.
Understanding you just said that you haven't gotten a lot of clarification, but one of the things the governor did say was gyms were to close. In Collegeville today, which is a very hard-hit area, a lot of cases in that area, a gym is open in Collegeville, a gym is open in Upper Providence. It doesn't seem that they're following that guideline at all. And driving around today, King of Prussia Mall was open, and I understand a lot of that is the governor's purview, but what's your message to residents?
Well, again, we are seeking clear communication from the governor's office on precisely what he meant yesterday. And if the governor issues an order, it is not the role of Montgomery County Public Safety to enforce that order. That enforcement mechanism is at the state level.
Should the King of Prussia Mall, Philadelphia premium outlets, should they be open in your view?
So as we've talked about here all week, and let me just remind folks, the individuals that are most at risk from the coronavirus are the elderly, people with serious underlying medical conditions, particularly pulmonary conditions, and people that are immunocompromised. And the steps that we are taking with the recommendations to stay at home if you can, reduce public gatherings, is to protect not only that group of people who are most likely to get seriously ill from coronavirus, but also to protect our critical workforce, our police, our hospital workers, other first responders. So the decision to remain open is, again, we're awaiting clarification from the governor's office.
So
However,
is there a
the
lack of
decision
communication?
to go there is up to each individual person in this county. We've given very clear advice over the last 6 days about who is most at risk, what we're trying to do with our mitigation efforts, and who should think twice about staying home versus going out.
What's your interpretation of non-essential retail?
I am not going to try to interpret what the governor said yesterday. We are waiting clarification on that.
Is there a lack of communication between Montgomery County officials and the governor if you keep telling us that we're awaiting word?
We're awaiting word, and that's all I'm going to say on that topic. Is there other?
This person, this
Let me go
patient.
over to Carl.
Dr. Kuch, have there been any fatalities from any of the cases?
I have not been informed of any fatalities.
And what about the other presumptive positive cases? Are any of those people still hospitalized? Can you
Yes.
tell us how many? Can you tell us how many?
I don't have that number at the top of my head, but there are individuals who are still hospitalized.
And who would notify you if there was a fatality, if one of these patients passed?
Probably the State Department of Health.
Okay.
Or the coroner's office would get it first and then we would get it.
Is that how that would go in this highly contagious situation, that it would be like a typical death, or would the Centers for Disease Control come in? I mean, this is all uncharted territory. I mean, would there be a transfer like that, or?
So I know the coroner's office is working on protocols right now to handle it. They're under review. We don't have any fatalities that we know of, but he is preparing for the inevitable that we might. So those plans are in place, how to handle where the bodies go, how to isolate them to make sure no one, comes in contact with them without protective gear on, etc. So
But-
I don't have those plans yet, but we should have them.
And with some of our patients going to Philadelphia hospitals, then that would become a Philadelphia issue and you may not be notified. Is that correct?
Well, again, I don't like to speculate.
Yeah.
We have not had a fatality. If that unfortunately happens in the future, we will clarify the process for you. I don't want to speak to a process that I don't have direct knowledge of. My goal in these press conferences, and I have been clear about this since we started on Sunday, I'm going to give you the factual information that I know, and I'm going to be clear with you when I do not have factual information. And I don't have information on that, and I'm not going to speculate.
You have an
You
update
talk
on
about
this,
social
though?
media, and is it that people are posting jokes and things like that? Is there a concern that people still aren't taking this seriously?
There's been a lot of untrustworthy information on social media, and that's why we have our hub site up, and we want people to go there. We can assure you that all of the information on our hub site is accurate and trustworthy. We are hoping that information like this graphic that we presented today will help people understand how serious this is. And the graphic that I presented yesterday, where we're trying to help people understand that we don't want to be that big spike, that many of these measures that we are taking to try to mitigate the spread of the disease will prevent this big spike that could potentially overwhelm our hospitals and overwhelm our first responders, very much like what you're seeing in Italy right now. We want to be this much smaller curve where the spread is less and a little bit slower. And with that type of approach, we hope and believe that we'll be able to handle the situation in hospitals. We won't overextend our hospital capacity. But certainly, if we have anything that looks like this yellow spike, our hospitals and first responders could easily be overwhelmed. And this is an information that we're conveying, and we hope people are taking it seriously.
As a medical expert, I know that you're saying it's up to individual people to assess, are they at risk for going out? We now have thousands of kids and families, not just in Montgomery County, but now going to be across the state, who are going to be, not at school. We were out today, people are out shopping, non-essential items. What is your overall advice to those people? Should they be out clothes shopping, fun shopping, that sort of thing, or do people kind of need to take a step back and stay in their homes for 2 weeks as much as possible?
It's our advice and recommendation at this point that's to take a step back and not do unnecessary errands. Spend some time with your family, get outside, maybe walk around the block, get in your backyard if you have one, spend some time together as a family as long as everybody's feeling okay. But this is not a time for unnecessary errands.
Like she said, I'm kind of playing off her. A lot of students are home. And a lot of parents, these kids take it as a vacation and they want to go hang out with their friends. What would you suggest parents tell their kids? Because parents are struggling with that, fighting with their kids, asking them, we need you to stay in, we need you to keep the groups to a minimum. What's your suggestion? And what do you say to parents?
I'm one of those parents, so
Yeah.
I have teenagers, so I'm having that exact conversation in my house right now. So I'm just trying to help my kids understand how serious this is and that they really need to limit their contact. As long as they have a pretty clear sense of the health of their friends, people can monitor temperatures, make sure they're not coughing, some of these basic things they can do. It's okay for probably a couple of them to get together, but we're really trying to avoid these large groups where maybe not everybody has checked their temperature, we're not sure who's been where. We really need to try to limit as much as possible.
How much more difficult does a diagram like that become when people are going out to stores, coming into
A lot more
contact with-
difficult, yeah. This is why we're taking these mitigation measures. We're trying to help people understand this was one person, and this is where we are 5 days later. So this is serious, this is real. People should not be gathering in large groups, particularly with people that you don't know their health history over the last several days, or their travel history over the last several days. This is what can happen.
4 new cases since yesterday. Is that alarming? Is that good news? I mean, put that into perspective. We're going from 13 to 17, roughly 25%. Put that into perspective for us.
Well, this is what other places have seen who have coronavirus, and this is largely what we anticipated as we've seen the numbers start to rise in most other countries or states that have been exposed like this. You do start to see a more rapid rise over time. So again, I just remind you that we had our first 2 cases last Saturday, and as of yesterday, we started with substantial mitigation measures because we had the impression that we were going to continue to see a rate of rise. So again, the goal here is to avoid that spike. We want to flatten the curve and get a much slower and hopefully total lower number.
Where's the case out of Cheltenham stand?
It's the same. So there's still apparently a very small number of people they're trying to get clarity from, but as of yet, and the Pennsylvania Department of Health has now taken that on, but as of right this minute, we have not been told that they have found a connection to a known presumptive positive.
Is there a concern of community spread, or is it still
Well,
because there
that's
isn't?
why we've been so focused on her, because if we can't find that, then that would be an example of community spread.
Have you-
And in a situation like this, where there haven't been other ones, does the concern over the community spread wane a bit, or is it still just as much?
I think any evidence of community spread is concerning and just continues to support the mitigation efforts that we've taken.
Have you been in contact at all with Monroe County health officials?
Can you offer some advice for people? You know, they're hearing stock up if you can for 2 weeks of food. You go into the grocery stores and some of them empty shelves. You've got people who live paycheck to paycheck, maybe can't afford to go and stock up, you know, before things run out. So can you offer some advice to people on, you know, how much they really should be stocking up on? You know, otherwise it's sort of leaving people hanging who maybe they're less fortunate.
So I think, you know, that's a really great question. This is a moment that our community really has to think about our community. So it's good to stock up on a couple days, 4 or 5 days of food, but don't take everything off the shelf. Remember that you've got neighbors that might be elderly or immunocompromised or have other serious medical conditions that really need to be staying home, and they really need to stock up. So if you're someone who's healthy, remember that 80% of the people who get coronavirus are going to have very mild symptoms. So think about that, and maybe leave a couple jars of pasta and a couple jars of spaghetti sauce on the shelf for that person who really shouldn't be out, you know, or really needs to minimize how much they are out. Because if they caught this virus, they would be extremely ill. So again, just think about your friends and neighbors, you know, try to be a responsible citizen. I have full faith in the people of Montgomery County. This is a wonderful, wonderful community, and I know if we all pull together and help each other out and work together, we will get through this. This will end. This is not our new forever. And the goal with the measures that we're taking is to get us on that flattened curve so not too many people get sick and we're able to treat them effectively or support them effectively when they're sick, and this will end.
Have you been in contact at all with Monroe County health officials?
I have not.
And then can you tell us, this is patient one, the very first one diagnosed? Not necessarily the one with the most contacts, but the very...
Actually, this is the one with the most contacts, and that's all I'm going to say.
Okay.
Question
All
about
right.
question
Yeah.
about county services. How much of the county is currently in operation, if that makes sense? There have been some statements from a few other counties today. Chester County officials sort of indicated that they're going to be going further and halting county services than some of the other counties around here. I don't know if there's a way to quantify this or not.
We have all county employees still working. They may not be working on site.
Okay.
Those that are able to work remotely are working from home. But all county employees are up and running. There have been some adjustments in our court system, and I'll refer you over to courts for those details. Most importantly around jury trials, but they need to give you those details. I don't have all those details at my fingertips, but all of our county services are still available. All right. Thank you, everybody. We will see you tomorrow at 2.